Welcome to the Mama's Village podcast, CT, where Fairfield County moms discover they're not alone in their struggles while uncovering the hidden gems, local treasures, and real solutions that make motherhood in Connecticut not just survivable, but extraordinary. I'm Abby Hartley. I am a mom of three, and I have an amazing guest today. I'm very excited. She is an osteopathic physician that completed her family residency training at UConn, where she was chief resident. Her practice is in Ridgefield, Connecticut, and she takes care of a range of patients from infant to adult. She lives with her husband and three children in Weston, Connecticut. Please welcome Dr. Andrea Gillis. Thank you so
Hey,
much.
thank you for having me.
So, tell me a little bit about yourself and your practice.
So, I'm Andrea. Nice to meet you all. I am originally from Connecticut. I grew up in Southbury, and me and my husband are both physicians, so we've traveled around quite a bit, and we decided to make Connecticut our home again about 3.5 years ago. Originally, we moved to Reading and then recently bought a house in Weston. And I work at a private practice in Richfield, Connecticut. It's called Cops Hill Family Medicine. There's four of us physicians. We're all family medicine trained, and we really do old school medicine. We do everything from newborns to geriatric care and everything in between, gynecologic needs, pap smears, a little bit of, prenatal counseling, postpartum counseling sprinkled in there, and even home visits sometimes. So we're really your true old school family medicine doctors, and we kind of pride ourselves on keeping that type of medicine alive.
I love
It's definitely a gem in this area because there's not a lot anymore,
Yeah,
for sure.
cool. That's really cool. Well, before we actually dive into our topics, I picked a couple because, whenever you have a physician in your life, you have like a million different questions to ask.
Sure.
But before we dive into it, do you have any hidden gems or local treasures in the area that you like to take your kids to or just go out yourself?
Yeah, we love exploring this area. Fairfield County they have so much to offer. Yesterday, actually, we went to Silverman's Farm in Easton, which is like, it's prime time for that. But I highly recommend going off season, like during blueberry picking and peach picking and raspberry picking. There's so many less people, and it's so fun for the kids. They have a little like petting zoo and a little playground for the kids. My kids are all under 5, so that's definitely one of our local favorites.
Amazing. So mine today, we actually I just took my daughters and a friend to go get their nails done. And it's a Sunday right now. And so I was worried that it was going to be packed. And I don't know what the deal is, but there was nobody there. And it was the one in Monroe next to Last Drop Coffee Shop, which is another one. Monroe, Connecticut is like this little, it's a little town, but it's also, you could like drive through it and miss it, you know?
My mom grew up there.
It's such a cute
Yeah.
area, like there's some really cute shops and stuff. And so we go there. I go there a lot to like, you know, they're restaurant like nice restaurants and stuff like that, but they aren't necessarily as busy as the ones in Fairfield. So
So true.
there was nobody at this nail shop, and I want to say the name of it. But now it is escaping me, so I need to look it up really quick. But really great manicure, totally fine. And I know there's a whole lot of talk about, the gel manicure.
Yeah, I know.
So I mean, I got it, and I don't know. My
I know,
kids
but what are you supposed to do instead? The dip, I guess?
I don't know. So it's Royal Nails and Spa, and it was great. It was a great experience.
I took my girls a couple weeks ago, not to get their nails done, but to go with me because I was like in a pickle and I didn't have childcare. And I was like, I've never done this before. And they were so nice at the place I went to. They were basically like babysitting my kids for free. It was so
Oh,
fun.
that's awesome.
I
Where
had
did
to
you
give a
go?
really good tip. It was a place in Wilton. I forget the name. I think Wilton Nail and Spa or something. They were so funny.
Oh, that's awesome.
They got a kick out of it because they like enjoyed the baby. It gave them something fun to do.
Yeah. How old are your kids?
So 5, my son just started kindergarten. 3 just started pre-K, and then 9 months old.
Oh, awesome. Very
Yeah.
cool.
What about yours?
I have a almost 17-year-old, a 15-year-old, and a 13-year-old.
Oh my goodness,
I know. It's insane.
teenagers.
I know. So, what are you reading, watching, listening to right now? that might be
So
helpful?
I am, this is funny coming from a doctor, but I am all about trash TV. And, because at the end of the day, I feel like all day long I'm using my brain so much, constant, so I come home and I just want to turn it off. I don't want to watch the news. I don't, I try not to get too into politics, not too deep into that. So I like to turn my brain off with some trash TV. I just recently watched on Hulu a show called Love Thy Nader, which is about the model Brooke Nader and her family. It's cute. It's like the new Kardashians. It's really got a good storyline to it.
I love it. That's awesome. Good one. What did I just watch? I'm watching The Morning Show right now on Apple, and I'm loving it.
Yeah,
I love that show, and
I never saw that.
I was wondering what they were gonna do next. It's season 4. It kind of feels I was thinking, like, how it ended pretty strong in season 3, so I was sort of wondering what they could do, and I think it's gonna be a good season.
I gotta watch that. I haven't seen that one. It's also like when you're a mom, you just have so limited time that you have
Yes.
to choose your shows very wise.
That's exactly right, which is exactly why I wanna mention them, because it's so annoying to, start something and then it's not good.
Right. And you're like, oh, I wasted that
Oh,
20 minutes I have.
exactly. Yes, exactly. Okay, so let's talk about you are an osteopathic physician. So I wanted to just ask the difference between an OD and an MD. And I assume there are misconceptions when somebody sees an OD at the end of your name versus an MD. So tell
Yeah.
me about an OD and what that means.
So I just want to correct it quick. So it's DO, which is
Oh
Doctor of
God.
Osteopathic Medicine. Don't be fooled because OD is optometrist. So
Oh no!
I'm not an optometrist. I'm a DO, Doctor of Osteopathic Medicine.
So sorry.
No, no, it's absolutely fine. It's like very confusing. If you're not in healthcare, you would have no idea. So basically, in general medicine, there's two different types of training that you can go through. It's allopathic and osteopathic. So allopathic is your traditional, in the sense, MD degree, and then osteopathic is a DO degree. So we're trained extremely similarly. The by the book training is basically exactly the same. The major difference is that DOs are trained with more of a holistic philosophy, and also we are trained with manual medicine as well. So, in addition to the books, we would do 8 hours a week of literally touching each other and learning the musculoskeletal system in depth. And doing extra testing to make sure that we knew that the body had all these connections and that it's the body is a unit. And when you're treating a patient, you're not just treating one system, you're treating them from head to toe. And that includes anything from physical, mental, social. There's so many things that go into play when you are treating a patient. So it's just a little bit of a different philosophy. I actually trained then in an allopathic residency program. So you can kind of switch over, if you will, to different training. And then some osteopathic physicians, once they practice, they use the manual medicine, others don't. So I use manual medicine as part of my practice. So, if somebody comes in with a sinus infection, we can do lymphatic drainage and sinus drainage instead of prescribing an antibiotic. Or if somebody comes in with back pain, we'll treat their short leg and see if their back pain gets better. So there's lots of ways to use that manual medicine in addition to kind of the more traditional regular medicine that we do. And you'll see DOs kind of sprinkled into every different specialty that's out there. You have DOs that are orthopedic surgeons, psychiatrists, oncologists, radiologists. My husband's a radiologist, and he's a DO as well. He doesn't do the manual portion, but some of us do. So there's kind of a big mix out there. But yes, we are very, common out in the Midwest. There's a lot of DO schools out there. In the Northeast, we tend to be a little bit more scarce, but that's just because there's less DO schools in the area.
So, do you take insurance? Is it yeah? Okay.
Yeah, so we take insurance. My other colleagues in my practice, all three of them are MDs. We take insurance just like any regular, family medicine practice. And then for my manual medicine portion, we also bill that through insurance, which is kind of amazing because, it's like similar to getting a massage or going to physical therapy, and your insurance will pay for it. A
Mm,
lot of that is out of pocket for a lot of patients otherwise.
wow, cool. So when you say manual, I know you were saying like sinus clearing and all of that. Are you talking sort of postural? Are you talking about, you know, exercises? Are you talking about chiropractic care? Like anything like that?
It's kind of it's hard to explain, but basically, I tell people this all the time. I'll explain it to you when I have you on the table and show you what I'm exactly what I'm doing. Similar to chiropractics, but not. I would say kind of a mix of massage and chiropractics, but then also being a medical doctor. So taking all of that combined, right? So the example that I use frequently, again, back to the sinus thing, is if you came in with a sinus infection and most of the time you go to see an MD doctor, they're going to prescribe an antibiotic, right? You come to a DO, and most of us will try to use our manual techniques to help the body naturally clear the infection. So, most of the time, sinus infections are viral, they can be bacterial in certain cases. So, if we open up the sinuses, if we drain the nasal passages, we drain the eustachian tubes, which are the tubes that go from your ears, to the back of your throat. Sometimes your body will just take care of it on its own if it opens up. And if you think about, the way that we function as a society, we live with a lot of chronic tension. We sit at computers, we're typing. So if we open up the body to get it to free up naturally, get those lymphatics moving, get the blood flowing, sometimes that's all you need. You just need to be touched, right? Instead of just giving pain medicine or, loading people up with God knows what. So yeah, so that's where our philosophy comes from. Of course, we still do treat with regular medicine, but we kind of use it as an additional tool for those instances where we can.
I love this. So, I was just going to ask you that. So, you can prescribe things, you can,
Absolutely.
all of that stuff, but you choose to take more holistic approach first if you can.
Yes,
Correct.
most of the time. I will
That's
say sometimes, patients come in, they just want that antibiotic.
yeah.
And well, of course, we have the conversations, but yeah, some people just, give me the meds, doc.
So, a naturopath,
Different.
very different. Okay.
Very different. Yeah.
Okay. It
Yeah, so naturopath is a completely different school. I'm actually not even that familiar with the process that they go through, but it's not Western medicine. It's a completely different approach. And the same with functional medicine. There's a lot of people out there that I don't know how familiar people are in this area, but you'll see functional medicine kind of sprinkled in there too, which basically breaks things down to the biochemical component and tries to target the treatment approaches in that regard, but very different than what we do in allopathic and osteopathic medicine.
okay. Well, great. Thank you for clarifying.
Yeah.
Sorry about DO. So DO is Doctor of Osteopathy.
Yep.
It is okay.
Yep. And OD is, I don't know what it stands for though.
Optometry.
Optometry doctor. We'll have to ask ChatGPT that one.
Okay. So what are some main things that you mostly see in your practice? And are you seeing more people taking this alternative, and would you call it an alternative route or
It's kind
holistic
of in
route?
between. Yeah, like I have a lot of people that seek me out because they're frustrated with the traditional medical world and they see it as an in between. And I know a lot of it comes down to just osteopaths are very in touch with the patient doctor relationship. We spend a lot of time getting to know our patients on a very personal level. So a lot of people want that personalized approach.
Mm,
My practice specifically also, they're amazing in that we can spend 40 minutes with our patients because we're private, we're not corporate owned. My boss has been in the area practicing in that community in Richfield for over 30 years. And it's actually him and his wife that own the practice, which is so sweet. And we kind of pride ourselves on being able to give that individualized, personalized approach. So people really seek us out for that reason because they're, sick of just being one of hundreds or thousands of patients. And a lot of people, you'll see a lot of people going to concierge medicine now because of that
mm,
as well. But then you have to pay a premium for it, whereas we're just through insurance. And I believe that you should be able to have that one on one personal attention from your doctor. You don't have to pay $6,000 a year to get that. So it's
yeah.
kind of sad that people feel like they have to do that. But there are certain people who are willing to pay for that one on one care, which is fine.
Um, so is there anything lately that's sort of coming up a lot in your practice? Whether it's questions or certain, even if it's like, is COVID coming back? That kind of thing.
Yeah, it's ongoing. I mean, it's constant conversation. Right now we're seeing COVID, I would call it like sprinkles, you know. Every once in a while we'll have a couple cases, every once in a while we'll have 5, 10 cases a week and then it'll disappear and come back. So knock on wood, it's been okay, but you know, I think we're ready to tackle it if we have to. But yeah, I mean, we see everything as family doctors, so it really depends on the season. It depends on, you know, the what's going on in society. There's so many things. But yeah, we get a lot of questions about you know, the vaccine stuff. We get a lot of pushback on a lot of vaccines, especially recently after COVID, you know, so there's a lot of conversation there. A lot of patients come in with a lot of preconceived opinions, which is great. You know, you should be an advocate for your own health. But I find that most of my patients are very humble in, you know, doc, I'm open to your opinion. Let's have a conversation and let's come up with a plan together. And we know that they're in medicine and in life, there's no perfect answer. It's really just weighing risks and benefits and finding that best approach for the patient.
Yeah. So you see pregnant moms, you see children, pregnant
Mhm.
moms,
Yeah.
you see perimenopausal women,
Oh,
you
yeah.
see menopausal women, you see like the whole gamut,
We see
every
everything. Yeah. So as family doctors, we're trained in OBGYN as well. Some family doctors come out of residency and they actually deliver babies and do the whole OB portion of things. Most of us, I would say like majority of family docs don't end up pursuing it just because it's a lot of extra call, it's a lot of extra, you know, taking on hours and things like that. But we are well versed in OBGYN in terms of prenatal, you know, labor, delivery, and the postpartum stuff. So I don't take care of the OBGYN patients, but they are my patients still, right? So they'll have their OB and then they'll still see me. So I definitely get to do a lot and see a lot. And I love it. I absolutely love it because then I get to take care of the mom and the baby. And it's that whole family approach, which is awesome.
Thank you for turning that light back on. So I do have a question. When we've sort of gotten information via politicians, and where we will not
What
name
do you
names.
mean? I don't know what you're talking about.
And pregnant moms, for example, must be very wary of Tylenol at the moment. Tell me a little bit about what you think about this. What are some alternatives to using Tylenol? If you're just like, you know what, I don't care what you say, I'm not going to use it just in case.
Yeah.
What are some recommendations you have?
Yeah, so I think, you know, without getting too political, I think what was said was very much a blanket statement that was almost taken out of context to a certain degree. I think what they were referencing was basically that they did, you know, these what we call meta-analysis. Meta-analysis in medical research is basically when you take a bunch of studies and you look at all of them and you try to come up with a conclusion from all of those studies combined. That's actually one of the stronger types of studies that we have in medical research. So they were coming up with the statement from a meta-analysis that basically showed that there was a correlation between frequent regular Tylenol or acetaminophen use during pregnancy to neurodivergent conditions. So it wasn't just autism. I want to get that straight. It was ADHD, autism, you know, there's a spectrum. It's not just one thing. So I think the way that it was phrased was autism equals or Tylenol equals autism, you know, and that is just not the case. We know that it's likely multifactorial. There are probably so many different factors that play into why children develop these conditions, whether it's genetic, you know, birth, environmental factors. Sure, regular frequent Tylenol use, I do think can put you at increased risk, but regular frequent use of anything during pregnancy can put you at, you know, risk. So I don't think it's necessary for women to be scared or weary about taking it as needed, you know, sporadically throughout the pregnancy. We also know that maternal fever is not good for a developing fetus, especially in the first trimester when the organs are developing. So, if you don't treat a maternal fever, the outcomes are likely not good anyways. So, I would, you know, my piece of advice to women is to just, if you need it, use it sparingly, but don't be afraid to take it and don't suffer in silence and don't sit there in pain. You know, we take care of the patient first, which is mom. Mom needs to be taken care of as well as baby during the pregnancy. So of course you want to be cautious, just like you would with, eating deli meat or drinking a glass of wine. But you don't have to be scared of it by any means. After this all came out, there's different medical societies. So the American College of Obstetrics and Gynecology, the OBGYN society, they basically said, keep taking Tylenol. The studies are not definitive at this point. There's a correlation there, but you can't say for certain that one equals the other, one doesn't cause the other, right? I definitely think we need more research. There's no question. So I think it came from a good place. I think the delivery was really poor. And I think we need more information before we draw these conclusions, as simple as that.
So, we should not gut it out.
Don't suffer in pain. Alternatives, I mean, that goes back to the osteopathic thing a little bit. I love treating pregnant patients with manual medicine because there's often nothing we can take when we're pregnant. So a little hands-on treatment goes a long way. So I always encourage my patients to come in and get treatment when they're pregnant because, yeah, we all like to be touched.
Yeah. Yeah, really cool. There's a lot of misinformation and information out there, especially with the internet, with AI, with
It's terrifying.
politicians. How do we make sense of it all? And who do we talk to? Like, where do we get how do we get our information?
Yeah, I mean, it's overwhelming in today's, day and age because there's so much available at your fingertips. But I think the first thing to say to moms is be overwhelmed by it. Don't feel like you have to know everything. Of course, you want to be an advocate for your health. You want to be as knowledgeable as you can when it comes to your growing baby or your kids or your toddlers or whatever it might be. But also, don't be afraid to ask the experts. That's what we're here for. That's what we train. We spent hours and hours studying and in school so that we can be advocates for patient and we can be somebody that they can turn to. So don't feel like you have to do it all on your own. The resources that are out there can be confusing. My recommendation is if you see something on the internet, if you see something on chat gpt or whatever it might be, just fact check it. Go to the original study that's quoted. Make sure it's a peer reviewed article, make sure the sources are there, and you just want to make sure it's coming from a good place. Chat gpt is a great tool. I think it's awesome for things here and there, but you just have to make sure that you're checking where it kind of, because it can be wrong. You have to just check the source. Yeah, it definitely is wrong. Like I've had people who type in their symptoms to chat gpt and it says like, you are dying. I go to the emergency room and I'll be like, no, just watch it. So it definitely has its limits.
One thing about ChatGPT is you get test results before your doctor does.
Yeah, yeah.
And so you don't know what the heck it means.
I
And
really don't recommend going too crazy on the test results because it is extremely hard to interpret if you have no medical knowledge. There's like a funny quote that says like, "Don't mistake Google or ChatGPT for my medical degree." Like, it's obviously you can't just interpret these complicated lab results without knowing the background, knowing what's going on in somebody's body physiologically, knowing the history. So you can try to look it up, but then you're going to go down this rabbit hole of like, oh my God, I have lymphoma or whatever, the worst case scenario, which Google will tell you.
mhm. Yeah. I
So, I mean, you can do it, look up your results by all means, but just take it with a grain of salt and like don't lose sleep over it until you hear from the doctor. Cause most of the time it's a whole lot of nothing.
Right. And vaccines are another area that, obviously we're all hearing about. What are some, what happens if you decide, I mean, there's big stakes here. So what are you telling your patients about vaccines and about the schedule and all of that stuff?
Yeah, I mean, the way that I approach it with people and people definitely don't want to be told what to do. So I go into it saying my job is to be here to help you make the decision, to help educate you, and then you make the decision for what's right for your body, right? We have patients in our practice who are quote unquote anti-vaxxers. So we work with people, but really the way that I phrase it is that every person should be its own case, right? So you can't just say everyone should get this across the board. You have to look at the patient individually. You have to look at their family situation. You have to look at their risk factors and then look at the vaccines that are available and make a decision from there. So like, for myself, I'm breastfeeding right now. So I choose to get the RSV, flu, and COVID vaccine. this fall, so that's my choice because of my situation. My husband, for example, isn't doing that because he's not breastfeeding. So it's just a patient to patient preference, and it's a patient to patient, situation that you have to look at each case as it comes. So they scaled back on the COVID vaccine recommendations a little bit. It's not now recommended for everyone. It's basically the high risk people again. So I always say the young and the old, we know are at the most risk. So those are the people who I really encourage to think about what vaccines are available and consider getting them because those are the people who we really want to protect the most.
You also have patients that are going into a new time of life, and
Right.
there are a lot of celebrities out there, and the time of life I am talking about is perimenopause and menopause. And there are a lot of celebrities out there that are talking about that right now. And I have to say it's very interesting. I don't tend to wanna talk about it. I don't That's not an area that I'm excited to touch. And so I don't necessarily sit and listen to Gwyneth Paltrow talking about
Right.
menopause, or like Oprah.
Right.
Um, I do know though that it is important, sort of like, your mom telling you about your period, that it's probably a point of your life that you should know a little bit about is coming up.
Definitely.
So I wanted to ask you about these kinds of symptoms. What age range are we talking about here? Do we have to worry about like when we got our period, as far as like when is this going to come? And how do you prevent it so that it doesn't become such a big part of your life? Is there anything we can do?
Yeah. So I have a lot of patients that are in this menopause range and age right now. So it's a very hot topic for me in my practice. Number one, I think it's amazing that we're talking about it and getting the awareness out there. But it kind of goes back to this misinformation thing that a lot of celebrities are out there. They are making blanket statements. They are, you know, Oprah has a show and again, it's not coming from a doctor, it's coming from a celebrity. So not one size fits all with the way that you approach menopause, right? Because everybody's symptoms are going to be different. So typically, it's going to start anywhere from early 40s to late 50s. What we typically see is that the symptoms will come first, and then your periods just start to get weird. They might get long, they might get short, they might get heavy, they might get lighter, they might disappear and come back. It's very much a range. A lot of it has to do with genetics. So usually if you look back and talk to your mom about how she was when she went through it, there might be some correlation there. There's really not a huge correlation between the age of when you had your period because everybody's body's a little bit different. But there might be some studies out there that show a correlation there. But from my experience, everybody's different in the way that they present and the timing that they present. But I think it's interesting because our generation has children a little bit later, so a lot of people are giving birth and then going right into menopause, which is terrifying.
Yeah.
It's a roller coaster, to go from postpartum right to menopause. And I think the other thing is nobody really prepares you, and there's all this talk and support around moms who are prenatal and postpartum, and then the perimenopause and menopause population is just forgotten in a sense. And so I do think that in that regard, it's amazing that social media is really making a big deal about it. So that's good that it's being noticed. In terms of symptoms, what to look for, it can be anything from vaginal dryness to decreased libido to changes in mood, irritability, itchy skin, joint pain, hot flashes obviously are the big one that everybody thinks about, but people just generally don't feel great and they come in and they're looking for an answer to what is going on. And a lot of the times we'll do these $1 million workups and then we chalk it up to perimenopause because it can present so different in so many different patients. But it's challenging. It's really challenging for my patients because it hits you like a ton of bricks for the most part. Some people get away with it. It's very mild and they don't have to take anything, but then other people it's debilitating. I have one patient that I think of offhand and she has brain fog that's so debilitating. Like she feels like she's early dementia. It's that bad. So there are different ways to manage it depending on what your symptoms are. There are several options out there. The one that everybody's talking about now is the hormone replacement therapy, which is
Yes.
basically, yeah, when you go into menopause, you lose estrogen. So the idea is that you give back a little bit of estrogen and progesterone for the most part. And those hormones tend to just make the symptoms less severe to a lesser degree, right?
Can you just get those? I mean, obviously you have
Yeah.
to talk to your doctor, but, like, is that something that is debated? I mean, I
It is. It is because the studies that were done recently kind of changed our mindset a little bit. It used to be that everyone was afraid of hormones because after a certain age, when you give back estrogen to the body, it can be cancer causing and blood clot forming. So some of the recent studies that were done on, we call it HRT, so hormone replacement therapy. Some of the more recent studies that were done show that short amounts and low doses are generally very safe and can make a huge difference for women. So we do recommend that the right patient, if they're a good candidate, we can prescribe those. But again, the way that I phrase it to people is that if your symptoms are mild, you don't need anything. So like Oprah's going out there saying everybody go on hormones, and that's just not necessary for most people. If your symptoms are severe, then of course we have options. We also have non-hormonal options. We can also treat the mood instability or the vaginal dryness separately without giving you back a hormone to put your body at risk, right? So there's several different ways to approach it. It's not a one size fits all by any means. It's looking at the patient, looking at the situation, talking about the pros and cons, talking about the adverse effects, and coming up with a plan that works for them. And if we're going to use hormone replacement therapy, the idea is low dose, short amount of time. And then hopefully it'll get them through that drastic drop off of estrogen. And then after a few years, they'll be, their symptoms will be a little bit less. And then they can come off of the hormones and hopefully be fine.
why so
Uh,
you're not on it for life.
no, although I do have some women in their 80s that are like, you're not taking my hormones away from me. It's hilarious. I'm like, okay.
Yeah, if you've been
I
on it.
don't recommend that. It is very much a risk. But yes, there are people out there take that risk for one less wrinkle or whatever it might be.
Mhm.
But most of the time, there's a lot you can do just naturally and supportively. There's a lot of over-the-counter supplements. None of them are, approved to show a major difference in studies, but some people swear by some of the supplements that they take. The biggest thing that it comes back to, and I'm sure people have heard this over and over again, but Mediterranean diet, eating really clean, cutting out processed foods, and exercise. It really comes down to movement. Like your body
Mhm.
craves exercise during menopause, physically, mentally, it is so important. So I usually recommend that getting in a good routine with diet and exercise in your 30s will save you so much time and energy when you get to the menopause age because you'll already be at a good starting point, instead of
Mm.
trying to play the catch up game.
Mhm. Yeah. The
But it's
weight gain,
complicated.
it is complicated because
It's
the weight
complicated.
gain, it feels like there's nothing you can do,
Yeah.
it
Yeah.
feels,
It's hard.
which, now GLP-1s, now there is something that you actually can do to
Yeah,
help.
that's a whole nother.
That's a whole other thing. We won't get into that this time, maybe another time because that is a really awesome
Exactly.
topic. But is it something where if you are, you know, if you clean up your diet, if you stop drinking alcohol, if you know what I mean? Is that something that could possibly change the way that you're
Yeah, I mean, when
presenting?
you do all those things, you cut back inflammation in the body, and through the menopause period, we know that inflammation can increase. We know that cardiovascular disease goes up. We know that bone loss goes up. That's why, and then inflammation in general in the body. That's why people have joint pain and things like that. So all of those things aim to decrease inflammation in the body. So if you do that in your 30s and you continue those efforts, it's not going to be as much of an uphill battle once you get to that age. But unfortunately, most people, are just fighting against the tide.
Yeah, yeah. And as far as, like, supplements that you recommend, is there anything besides HRT? Is there anything that you recommend?
Yeah, I mean, there's a lot out there. You just have to be careful because a lot of the supplements, the marketing is just crazy. I'd use the example of like if you look at prenatal and postpartum vitamins, they're basically the same thing. It's marketed to prenatal patients versus postpartum patients, right? So a lot of it is a marketing ploy, a lot of it is a money thing. And first and foremost, vitamins you should be getting from your diet. If you eat a clean diet that is rich in fruits and vegetables and lean proteins, if it's colorful diet, you should be getting most of the vitamins you need. If you are, say, a vegetarian or a vegan, that's a different story, right? Because you're missing some of those key nutrients. So if you're deficient in something, obviously I recommend taking a vitamin. But if you eat a good diet, a healthy Mediterranean diet, you don't necessarily need to spend hundreds of dollars on vitamins every month. When you're going through menopause, there are some things that have been shown to be helpful. My favorite ones out there are turmeric. I really like turmeric just as a general anti-inflammatory in the body. People swear that it helps with joint pain. I also like chondroitin, which helps with joint pain. And then there's some, over the counter multivitamins that are marketed towards the perimenopause stuff. I mean, and there's a lot of natural things out there. Again, I'm not like a naturopath, but I think echinacea is a good one, for immune support. So there's a lot that's available, but you have to be cautious with it. And because you can literally spend hundreds of dollars a month on these things that might not be doing anything, and
Right.
you will just be urinating them out.
Yeah. And then is there anything like manual, anything you do manually to help at all? Is there anything
Just
to
to
do?
promote, lymphatic drainage and things like that. But exercise can also do a great job at that.
Mhm.
So
And lymph nodes are basically your immune system.
immune system, exactly. Yep.
Yeah.
But again, we get so stagnant in what we do. So movement is key, and even as you get beyond menopause into your 60s and 70s, when you retire, the people that are successful through that transition are the people who are moving. Once you stop moving, we see it all just start to go downhill. So if you continue that exercise, even if it's 2-pound weights, strength training, it's amazing. So the key really all comes back to exercise. And I know people, that's not the quick fix everybody's looking for, but that's what the recipe is. That's what it is. You
Yeah.
got to do it. You got to put the work in.
When you finish going through it, is there any more roller coaster? Is the roller coaster over?
I mean, other roller coasters, right? Like, but it's funny because I'll talk to women in their 60s and they feel great. They're not complaining. It's the women who are early 40s to 50s that are just like, "Yeah, Doc, what's happening to me?" But once you hit your 60s, most people feel okay. So it's not that you're going to feel like this forever. Most of the time, you're going to hit that plateau. Your body will get adjusted to the new normal.
Mm.
But it's what I tell people is you have to, ride the roller coaster, right? You have to work with the new body that you're given. Whatever you've been doing for the past 20 years might not cut it anymore. You might have to work harder to get the same results. And that people just don't want to hear that. They just,
Yeah, that's hard.
they want the injection to lose the weight in 6 months.
Mm. Yeah, that's hard. Okay, is there anything that you wanna tell moms, that you wanna spread the word about?
Yeah, I mean, from a medical perspective, again, I think there's so much misinformation out there. I think the biggest thing is stay knowledgeable, but allow yourself to not have to know it all. You don't have to feel like you need to know all this medical jargon and be up to date on everything. That's what the experts are there for. That's what we use each other to help. I have a financial advisor because I don't know anything about finance. I'm in medicine. That's what I'm there for. So, don't take on too much. Don't pressure yourself. We have enough on our plates being mothers. Number one, you're doing a great job if nobody's told you yet. It's a lot of work. It's a lot of work, but use your resources wisely, really, and take control of what you can control on a daily basis. Don't focus on what is out of your hands.
How many times, a year should you see your DO?
So annually, if you're young and healthy, and then as needed, right? If anything comes up, but definitely my biggest thing is be an advocate for your own health because I think a lot of people will come in and just expect a doctor to diagnose everything. But if you don't speak up about it, we're not magicians. We can't see into your body. We have to hear about what the symptoms are. We also have to get the story. We have to get the history from the patient,
Mm.
able to put the pieces together like a puzzle. So if something isn't fitting, if something feels off, speak up because usually you're right. I had a patient a couple days ago who she was having horrible symptoms, and every doctor just kept saying, "You're fine." The CAT scans were normal. Her colonoscopy was normal, and it turns out she had this really serious condition. And we spoke up because she came to me, and we called her other doctor and coordinated for her. But if she hadn't pursued it, and if she hadn't spoke up for herself, we probably would have never diagnosed what she came.
Mm.
So
Yeah.
definitely be your own advocate and listen to your body. You know your body better than anybody else can. And don't let any doctor ever tell you you're crazy.
Yeah. Yeah. That's great. Yeah, absolutely. So we can find you in Ridgefield, Connecticut. Do you have a website? Do you have
Yeah. Yeah.
socials and all of that stuff?
Yep, we are Cops Hill Family Medicine. You can find us at copshillfamilymedicine.com. We are also on Instagram as Cops Hill Family Medicine, COPPS. And we have a Facebook page as well. So follow us and like us on Instagram. I run the social media page. I'm not that great at it, but I try. It was not part of my medical degree, but we're working with it.
That's great. Well, thank you so much for talking to me about this stuff. It's really great
Thank you
and
for having me.
appreciate it. If you come across anything, and I do want to talk about the GLP-1s, I think
That's the next podcast.
that's the next time. But yeah, if you come across anything, please let me know. Thanks a
Will
lot.
do.
All right.
Thanks, Abby.